So we know that the current humanitarian and development systems were not set up for the sort of crises we're seeing today. We're seeing protracted, recurrent, extensive crises in sort of key parts of the world, and the development model doesn't work, the humanitarian model doesn't work. And if we were designing programming now for places like the Sahel or DRC or Yemen or Somalia, we wouldn't have the models that we're using now.
So the kind of idea is that protracted crises are increasing globally, and international labour standards provide some kind of blueprint or long-term direction for development, but these could also be more useful in nexus discussions, especially in protracted crises, to guide the overall direction of actors. I think the overall finding from the different countries we looked at is that a holistic systems level approach would be perhaps useful in protracted crises. So expanding beyond just the idea of reducing poverty or responding to humanitarian vulnerability and need, to covering the 9 life cycle contingencies through things like social insurance or individual allowances. So going beyond reducing poverty to also preventing poverty and vulnerability.
Really, it is important to understand the context of the beneficiaries. What is the life experience of these beneficiaries, so that it is important to understand them and to incorporate their views and their voices in a design process and in the implementation process. So I hope that the findings of this research can help our policy makers to improve the program.
As I said, the humanitarian sector is the prominent actor in providing assistance to refugees, but in protracted contexts, as time goes by, that becomes less and less relevant to the lives of people. Sure, having support when people are first displaced is necessary, it's important, it's significant, but as time goes by, people are looking to see how their lives transform. So I think we need to kind of think more clearly about that relationship between social protection and work, and how it intersects with the kind of interventions that we see from the humanitarian sector.